A very good evening to all my dear MOS members and the ophthalmic fraternity, fellows, PGs who all have joined. Today is a very interesting topic that we have, and that is from the MOS Young Ophthalmologist group. This is the second of the webinars which we are trying to show it to you, and we have an expert with us. And the expert faculty, everybody knows him very well. No, none other than Dr. Santosh Honavar, the chief editor of the Indian Journal of Ophthalmology, a teacher par excellence, and he is part of the Center for Sight, what we say, the teachers initiative that they are running. Now we have two young Turks with us, Dr. Pooja Mehta and Dr. Himika Gupta. Both are co-fellows of Dr. Santosh Honavar, and they are going to moderate the whole session. Today's talk is regarding the fellowship in India, fellowship training in India and abroad by our faculty, Dr. Santosh Honavar, who is going to relate everything about it in detail for all of you. So stay tuned with us. The moderators, I just introduced both of them. Dr. Pooja Mehta, she is an MBBS MS from DY Patil, Navi Mumbai. She has done a clinical retina research fellowship from Johns Hopkins University, Baltimore, USA. She has done a short-time phaco refractive fellowship from Narayan Netralaya, Bangalore. She is a consultant at the Vision Eye Center, Mumbai, consultant at the CK Eye Hospital, Saharanpur. Welcome, Pooja, to this our webinar today. Please take over as the try and intro Dr. Honavar first, and then I'll introduce Himika also later on. Over to you, Pooja.
Thank you so much, sir, for the warm introduction. It's my honor and pleasure to introduce Dr. Santosh Honavar to the show. Sir is trained at the RP Center and the Wills Eye Hospital in Philadelphia. He's an established ocular oncology department at the LVPI Hyderabad, was the associate director of LVPI and established the residency program. He currently heads oculoplasty and oncology at Center for Sight and CSF Education. He's awarded the Shanti Swarup Bhatnagar Award by the Government of India, Jerry Shields Award by the Asia Pacific Academy of Ophthalmology, and of course the first Indian to receive the Lifetime Achievement Award by the American Academy of Ophthalmology in 2019, and honorary fellowship of the Royal College of Ophthalmologists UK in 2020. He is currently the editor of the Indian Journal of Ophthalmology. This is just like a bookish introduction for sir, but everyone knows he needs no introduction. So over to you, sir.
Yeah, before Dr. Santosh Honavar starts, we have an expert panelist with us. A very pleasant surprise for all of you. Father of Dr. Pooja and a well-known surgeon in Mumbai. He is the big boss of Bombay. We have Dr. Himanshu Mehta with us. Welcome, Dr. Himanshu Mehta, sir. Over to you, Dr. Santosh, please.
You want to introduce Himika?
Himika को बाद में करेंगे ना, during the panelist racing. उसका बड़ा introduction है. Okay, go ahead.
Good evening. I thank Maharashtra Ophthalmological Society Young Ophthalmologist Forum for this opportunity. I was asked to speak on ophthalmology fellowship training. So what after residency? Generally, it's become a trend currently not to stop at residency and go beyond either do senior residency or fellowship. Senior residency often is unstructured and does not have focus on subspecialties, where fellowships are generally focused on subspecialties. So I'll be talking about why to do a fellowship, when exactly is the best time to do a fellowship, what fellowship to choose, what are the possible options as to where you can do the fellowship, and how to go about it. This sums it up. Why exactly do you need to do fellowship? Because diffuseness is a disease, and fellowship lets you focus on a particular subspecialty or a particular aspect of ophthalmology in which you can excel. So if you want to focus on something, then fellowship is the way to go. As an ophthalmology resident, you tend to be general ophthalmologist, but beyond that, if you really want to excel in a particular aspect of ophthalmology, then you must do fellowship. So it helps you focus on a particular area of ophthalmology. thereby acquiring the cutting edge knowledge in that aspect of ophthalmology, and it adds value to you. In fact, it opens up many doors which are otherwise shut. If you ask for a job post MS or MD ophthalmology, then you may not get a very well paid opening in many of the hospitals. But following fellowship in a reputed organization, all these doors open up. It also helps you find mentors for life. You need mentors because you need to learn from their experience, and they need to guide you over a very long period, all through your career, in various phases of your career. And fellowship often helps you find a mentor. It also helps you stand out from the crowd. For example, if you're highly specialized in one particular aspect of ophthalmology, even within it, for example, if you're specialized in pediatric retinal diseases, even within retina, then that helps you stand out from the crowd and distinguish yourself as a specialist in that particular aspect, thus getting reference. For residents, of course, immediately after residency is the best time to do fellowship. If you are a practitioner already, it is okay to be a practitioner. You may gain experience as a comprehensive ophthalmologist, but after 5, 6, 7 years, you may find that, well, you're getting bored with comprehensive ophthalmology. You want to get an edge. You want to kind of have something else as a focus in addition to doing a broad-based comprehensive ophthalmology practice. So then you can go for a fellowship somewhere in the middle of the career. Any time is the right time. There is no denial of the fact that any time is the right time for fellowship. Now, what are the types of fellowship? Observership is not a fellowship, but even a 3-month observership in a particular aspect of ophthalmology or a particular aspect of subspecialty often helps you get knowledge. So observership is listed. Otherwise, there is what is called short-term fellowship, which is anything which is 3 months or more. Observership is anything less than 3 months, ranging from a week to a couple of months. Long-term fellowship, research fellowship could be in basic sciences of ophthalmology or clinical research. Gold standard fellowship is, of course, long-term clinical fellowship, which ranges from 12 to 36 months. The range is very broad. In fact, many of the institutions offered a 12-month fellowship, some offer an 18-month fellowship, some offer a 2-year fellowship, and some offer a 36-month fellowship, which is like redoing the residency. The duration is so long. Now, what about observership? Observership is between 1 week to 4 to 8 weeks. You generally observe in the clinic and in the operation theater. There is no direct patient contact or no direct hands-on. It provides an overview into the functioning of a particular consultant or a specialist and the department and the institute. It is very easy to get. Sometimes it needs advanced application. The role of observership for residents who are seeking fellowship is that it is a dipstick test before a long-term fellowship. For example, in many of the residencies, you're not exposed to high-end retina, high-end cornea, etc. So if you want to test your aptitude for those specialties before you actually go and do a long-term fellowship, then you might want to do observership. Many of the residents choose to do observership in the best of places. Say, doing observership in refractive surgery, Narayan Netralaya, or cornea at LVPI, or retina at Shankar Netralaya, helps you get a flavor of what you can get during a long-term fellowship. So it's extremely good for a resident who is not decided yet on what subspecialty would he or she wants to take for fellowship. If you are a practitioner already, then observership will get you reoriented to the recent advances in that subspecialty. So even if you have been a fellow already after 5 or 7 or 10 years, it's not a bad idea to go and do observership in the same institute or in another institute to acquire that additional knowledge. A short-term fellowship ranges from 3 months to 6 months. Generally, it is 3 months. Sometimes you can extend it to 6 months. It again is mainly observational in the OPD or OR. You can and are allowed to examine patients. You can even scrub up and assist your mentor. It's relatively easy to get. So it's basically for those who are already specialists. Say if you're a basic level cornea specialist and you want to learn something about component surgery or lamellar corneal surgery or particular aspect of refractive surgery, then short-term fellowship is very good. It does need an advance in application, and some institutes ask for payment. Some of the short-term fellowships include microsurgery or phacoemulsification fellowship or small incision cataract surgery fellowship or glaucoma fellowship, medical retina fellowship, refractive surgery fellowship. These are some of the paid fellowships that are offered and are generally performed. Long-term clinical fellowship could be post-DO. If you're post-DO, then most often you're offered a comprehensive ophthalmology fellowship and not a subspecialty fellowship. Long-term subspecialty fellowships are offered for those who are DNB, MD, MS, or FRCS. Ranges currently from 1 to 3 years. LVPI fellowship, in fact, is 3 years now. It's highly competitive, but provides excellent exposure. In fact, it provides cutting-edge knowledge in both medical, clinical, and surgical aspects of that subspecialty. It's a paid fellowship, so you really don't have to worry about the payment. At least sustenance allowance is what is given. Now, what are the subspecialties do you have? Of course, you have comprehensive ophthalmology, and you can do fellowship in every aspect of ophthalmology, cataract and refractive surgery or refractive surgery alone. Sometimes cornea and refractive surgery are together, or it could be cornea or anterior segment. Uvea and immunology, and sometimes uvea and pathology go together. Glaucoma, medical and surgical retina or vitreoretinal fellowship. Ophthalmic plastic and facial aesthetic surgery. In some institutes, ophthalmic plastic surgery is combined with ocular oncology. Pediatric ophthalmology and strabismus with or without neuro-ophthalmology or neuro-ophthalmology as a standalone fellowship, and ophthalmic pathology fellowship. So why do you need to do comprehensive ophthalmology fellowship? Sometimes residency programs are suboptimal and they may not train you in all aspects of ophthalmology, and you may not be a confident clinician at the end of your residency. So comprehensive ophthalmology is specifically for those who are not confident at the end of the residency program to practice general ophthalmology. In a tier 2 or tier 3 city, general ophthalmology practice would mean that you're able to see and manage something like 80 to 90% of patients that walk into your clinic. If you're not confident of doing that, and if you have hesitation in doing that, then you must do a comprehensive ophthalmology fellowship beyond residency. So main indication is suboptimal residency program, and if you lack clinical skills. If you have done a diploma in ophthalmology, then I would very strongly recommend a comprehensive ophthalmology fellowship because it qualifies you for FRCS. You can take FRCS Glasgow or Edinburgh exam if you have 4 years clinical knowledge. So DO plus 2 years of comprehensive ophthalmology would make you qualify to take an FRCS examination. And in many institutes such as LVPI, comprehensive ophthalmology would include a subspecialty year. That means that it is 2 plus 1. So you do a 2-year comprehensive ophthalmology fellowship followed by 1 year of a subspecialty, maybe retina, glaucoma, whatever you want, generally by merit. And so at the end of 3 years, you have your DO already. You can do your FRCS and you have a comprehensive ophthalmology broad-based training. And then you have a subspecialty fellowship to add on to it. So it's a very, very attractive proposition for somebody who has done a DO. Of course, if you have done a DO, you can also do secondary DNB followed by fellowship. That means that you invest 2 years in secondary DNB and then you take an FRCS as well. And then you can do a 1 to 3 years subspecialty fellowship, slightly longer haul. But of course, you have the sanctity of having a secondary DNB instead of FRCS, which is not a recognized degree in India. It is, of course, recognized by the patients, but legally it is not a recognized degree in India. If one wants to do good comprehensive ophthalmology practice in a tier 2 or 3 city or a town, so you're very clear that you don't want to practice in a, say, cosmopolitan city, but you want to go back to your taluk or district or a town and then want to practice a very broad-based ophthalmology, you want to be a reasonably busy clinician doing fair amount of surgery, but not the high-end surgery. You want to do, say, cataract, trabeculectomy, all glaucoma procedures, medical retina lasers, horizontal strabismus, a bit of oculoplasty, etc. then comprehensive ophthalmology fellowship is an extremely good proposition. So depending on what your career objectives are, you can choose comprehensive ophthalmology fellowship. Now, about other subspecialties, I really don't know how to advise anyone to choose what. Of course, you can do a market survey, so-called market survey, in your intended location of practice and see if that particular geographic location lacks a specialty. For example, if your location lacks, intended location of practice lacks oculoplasty specialist, then you can choose to do it. That's one way of looking at it from totally commercial as manner. But I would, for subspecialty fellowships, I would say strongly passion is very important. If you are passionate about a particular, specialty, for example, cornea, glaucoma, neuro-ophthalmology, then you must choose it. So passion comes on top, followed by your level of interest and your aptitude. Some are really not good at doing, say, microsurgery. They may not want to get into it. They may want to do, say, strabismus or oculoplasty surgery. Some may not like retina at all. Also, what kind of background do you have? Do you have an ophthalmologist parent or a setup already in place? What is your intended place of final practice? What type of practice do you want to set up? Do you want to join a group practice, or do you want to be an individual practitioner? Which means that investment will come into place. If you're done retina and if you want to be an individual practitioner, then you have to be ready for a big time investment, or same for refractive surgery, and your appetite for risk. Out of all this, passion is very important. It's said that the only way to do great work is to love what you do. And if you're passionate about what you want to do, obviously you would want to do well. It's also said that I would rather die of passion than of boredom, which is very true. So if you're passionate, then you might want to do better in that particular aspect. Okay. Now, where exactly do you want to do your fellowship? There are several considerations. Some go for reputation of an organization, irrespective of, see, for example, all institutes don't offer fellowship in all areas of ophthalmology of equal quality. There are ups and downs. In some organizations, retina may be very good, in some cornea may be very good, but it is very rare to find that all aspects of ophthalmology are at cutting edge in every institute. That is very rare. So some actually want to settle for reputation rather than the competence that the fellowship offers. Some want to settle for more of academics. Some want more of hands-on. Some look at financial issues, which wherever the stipend is more, and some focus on the intended area. Now, this is in alphabetical order that I have listed. These are the four most common destinations for fellowship. Listed in alphabetical order because I can't differentiate one from the other. All are extremely good. Aravind Eye Care System, LVPI, Narayan Netralaya, Shankar Netralaya. There are, of course, many more. And if you go through the Indian Journal of Ophthalmology, there are two long lists of, well, the font size is too small, but you can go through the journal itself. There are 2 pages of fellowship listings, and it is divided by subspecialty and also the institution that offers it. You can see about 50 organizations are listed here, and the address and the contact email. And of course, the websites are great source of information. So I have no particular interest in recommending one over the other, but you can do your, a little bit of homework, talk to fellows from or your seniors who have already done fellowship from those institutes, and look at these very critically before you jump into doing a fellowship. Of course, contact information is all there so that you can reach out to them. Now, what about subspecialty senior residency? RP Center, PGI offer subspecialty senior residency. Otherwise, senior residency is generally non-specific. It is comprehensive ophthalmology, maybe with a little bit of focus on a particular aspect of ophthalmology. There is fellowship of the National Board of Retina in some institutes. PGI offers that. I believe Shankar Netralaya, LVP also offer that. One new additional thing that has come up is MCH in cornea and anterior segment started in PGI Chandigarh. RP Center may also be trying to start it soon. So this is very attractive because it's the only MCH degree in ophthalmology that you can get Otherwise, you had fellowship of the National Board of Ophthalmology in retina. So depends on what you're interested in. Now going on to international fellowship. Beyond national fellowship, what can international fellowship offer to you? International fellowship beyond the national boundaries broadens the horizon, widens the perspective, because you would have always been exposed to what is done in India, what is taught in India, but now suddenly you are exposed to a very wide spectrum of ophthalmology, which is beyond what you see in India, beyond what we do in India, sometimes even beyond what we can even think being trained in India. So it simulates to think different and do different, and helps you find a niche area. Niche area even within, for example, retina cornea, you might want to find a small niche area. Of course, in India, a small niche area can spawn a large practice because the numbers are huge here. So when you come back with training in a small niche area, you can actually be extremely good in that and build a large practice in India. You also understand different work cultures. Why is that important? Because you learn how to deal with life, how to deal with people. It provides cutting edge knowledge, because these are organizations or institutes and mentors who are producing knowledge. An institute is defined as something which produces knowledge, disseminates knowledge, and practices cutting edge knowledge. So basically, you're training in an organization or with a mentor who is at the cutting edge of knowledge and who is producing new knowledge. So you're already very high in terms of your knowledge level when you come back with an international fellowship. It helps you find mentors, of course, you helps you see the world, and there are many sweet side effects because you are exposed to huge amount of very well curated medical records. In Wills, for example, we used to have medical records right from 1970s when the molecular oncology department was started. All complete set of medical records you have, so you can do a lot of retrospective research. You can write a lot of manuscripts. There is good statistical backup, and you get nice mentors who can actually guide you through the whole process. You have unrestricted access to library, 24/7 access to every book that you can think of, hard copy as well as soft copy access, and every journal dating back to the first issue of every journal, hard copies as well as soft copies. So you have unrestricted access to knowledge. Documentation, of course, you will learn very well. And again, you stand out from the crowd. Now, when exactly do you want to do international fellowship? Some want to do it right after residency, but I would discourage that. The best time to do international fellowship is after clinical fellowship in India, because you're already at a particular level and you can impress your mentors with that background knowledge which you already have. You can also do it later on in life, in the mid-career, or after working as a specialist for a few years. I actually did that. I started working at LVP as a consultant in oculoplasty. Then after 3 years, I thought that I wanted to do something different, which was actually lacking in India at that time, ocular oncology. So I went for my fellowship, 3 years following my joining as a consultant. So many of us do that, because after working for 2 or 3 years, you find that suddenly that, okay, this particular area in ophthalmology is lacking in India. There are patients, but they're not being optimally managed. You might want to get some knowledge in that particular aspect. But any time is the right time. Now here again, we have the whole list: observership, short-term fellowship, long-term clinical fellowship, long-term research fellowship, and collaborative fellowship. Like us in CFS Oculoplasty Oncology offers a collaborative fellowship where 1 year to 18 months are done in India, followed by 6 months to a year in the US, either with New York Eye Cancer Center or with Wills Eye Hospital with Carol and Jerry Shields. So there are collaborative fellowships as well. Now, we talked about observership earlier, but again, in international fellowship perspective, observerships are mainly done when you go for an international conference. So before and after an international conference, if you want to visit a particular institute, you do that, and that's a week-long or a month-long observership. Short-term fellowship in international perspective You can examine patients. It's relatively easy to get. It needs advanced application. Some institutes again ask for payment. The most famous short-term fellowship is the ICO Fellowship, which is 3-month fellowship, and you're offered about $6,000 for 3 months, which is sufficient for you to stay. You can do short-term fellowship if it is say 3 to 6 months with a tourist visa. But if it's slightly more than that, or if you want to stay back for more time, then you may want a long stay visa. If it's 1 year, then you need a J1 visa. You can apply by direct contact or through ICO. Direct contact is you go through the website or write to the mentor directly with your CV. So basically, for anything in an international situation where you want to do it with the best, then you need a reasonably good CV with some evidence showing that you're interested in a particular aspect of ophthalmology, focus, for example, few publications, good presentations in that area. Now, long-term clinical fellowship internationally is the gold standard, of course. Well, you can do with USMLE, without USMLE. If you're, in fact, currently, I think even if you don't want to settle in US, if you have or if you do USMLE, then it opens a whole range of opportunities. I'll show you that in a little while. But I believe if you have USMLE or if you want to do it, you can easily do it currently. That will get you the best of international clinical fellowships in the US. In 2 states in US, USMLE is exempted, California and Philadelphia, Pennsylvania. So you have access to any of the institutes in California and Pennsylvania without USMLE. Now there are non-USMLE international fellowships. Some of the USMLE requirement is waived if they are in a need for a fellowship candidate. I will show you that as well. You can do that post MD, MS or FRCS. It's done best done post clinical fellowship. Ideally, you should have a prior work or research experience, and it ranges from 1 to 2 years. So what all do you need to get a long-term clinical fellowship? You need a strong CV and a recommendation, not the kind of recommendation that we give in India, but a mentor-to-mentor recommendation, a true and honest recommendation, which kind of brings out the strong aspects, clinical, research, and surgical aspects of the candidate. These are highly competitive, but provide excellent exposure. Some of these are actually paid fellowships, and you get a good amount of money to live in the US for the year of fellowship. And if you're interested in residency and if you've done a USMLE already, then this is like a pre-residency fellowship. You can actually get into ophthalmology residency if you do a good long-term clinical fellowship before residency. It's actually a very wise thing to do if you're very keen to settle in the United States. Now, all the subspecialties are listed here, but what is easy to get is listed at the bottom. Pediatric ophthalmology and strabismus, even ocular oncology, relatively easier to get in the US, and neuro-ophthalmology and ophthalmic pathology are relatively easier than others. Where exactly you want to do it? Again, a lot of considerations. Wills, Bascom Palmer, Mass and Deer are in fact, University of California, San Francisco, San Diego. These are some of the favored destinations. So how do you know there are vacancies? You can look at journal advertisements, online advertisements, or even without bothering to look at an advertisement, you can directly apply. You can go through the websites of each of these, and they have a fellowship section in the website. You can have a direct contact with the intended mentor, or through your mentor. You already have a mentor in India. Ask your mentor to write to somebody who is who can possibly help you out. And you can also go through International Council of Ophthalmology and International Ophthalmology Fellowship Foundation. So ICO has divided itself into 2 now. ICO original stands, and the second one is called IOFF. Both of them offer international fellowships. If you have USMLE, then the gold standard is that you go through the US Fellowship Match Program, or SF Match. There are non-matched programs, and third is international fellowships. Let me go through SF Match first. If you are familiar with the US system of residency selection, then you probably would have heard of SF Match. SF Match also has Ophthalmology Fellowship Match. What are the timelines? It takes exactly 1 year. For a term that is starting in July 22, you should have applied on July 1st, 2021, when the application actually begins. Most of the American fellowships, clinical fellowships, start on 1st of July each year, and the 1st of July of the previous year would have been the starting. SF Match is a website, you can go and look at it. But if you think that if you don't match, or if you're slightly late for the match, or if you don't even have USMLE, can you still get these high level fellowships? Of course you can. Today I did a small search. I just filled in Ophthalmology Fellowship for 2022, right? See, look at this. Storm Eye Institute has an immediate vacancy for a glaucoma fellowship. Retina Institute has an immediate vacancy for a Ophthalmology Retina Fellowship. This is beyond the match. This is like spot admissions for MBBS or MS, where, you know, all the matches have already been catered to, and these are the seats that have been left out after the match. So this is a golden opportunity for somebody who's from a non-US residency background to do a great fellowship. Look at the numbers. Fellows are expected to graduate with over 800 surgical cases in retina. That is what the Retina Institute offers, and that is off match. You don't have to go through the match. And some of these are in need of fellows because their clinical volume is so high that they cannot do without fellows. So they may even waive off your USMLE and take the responsibility for you on themselves. There are 5 pages, in fact, of post-match fellowship vacancies. Most of these are for immediate opening. Post-match fellowship vacancy available. You can look at Wills Eye Hospital Global Ophthalmology Fellowship. You have University of Oklahoma Global Ophthalmology Fellowship. There are lots of it. So that's one thing that you can look at. Next is International Fellowship itself. International Fellowship is offered by University of California, Los Angeles, where as I said, California waives off USMLE. You don't need USMLE to do an international fellowship. And this is a particular opportunity that is there in California. Now, long-term research fellowships, qualifications are no different. You would need a basic postgraduate qualification in ophthalmology, ideally post-fellowship. If you have prior research experience, it's all the more good. It is less competitive. Now, where all is it available? You have in Stanford, which is the epitome of knowledge, where you have a very nice ophthalmic innovation fellowship program, which is research-based. You have cornea research there, you have adaptive optic imaging research, you have glaucoma research, you have neuro-ophthalmology research, you have retinal biology and diabetic retinopathy research in Stanford. So if you have a research orientation, then you can choose any of this. Now, Harvard offers what is called International Research and Training Program, where you're trained to do research, clinical as well as basic science research. You have nice mentors who will train you to do that. There are focus areas such as diabetic eye disease, vascular retinal diseases, and cornea, some aspects of cornea. RO offers named fellowships. These are Pfizer Translational Research Awards for young ophthalmologists, Roche Collaborative Research Fellowships, Epstein Award, etc. So most of the AWO fellowships are named awards, and these are considered honors, but these are relatively easy to get because many ophthalmologists are not keen on doing research. And if you have a good CV already, then some of these applications will become a reality. In Canada, you are offered hands-on without, say, having to clear an examination, qualifying examination. Canadian fellowships are typically very well-paid fellowships. You have no exam to clear, but if you already have an FRCS Edinburgh or Glasgow, that is great. You need IELTS score of more than 7. It is directly by contacting the institute or the mentor. Canada has a leisurely pace and a friendly work culture, not as competitive and intense as US, has reasonable volume. So you can enjoy life in Canada as well as work there. There are two universities that offer good fellowships, University of British Columbia and University of Toronto. This is University of Toronto list of subspecialties. You have almost everything that is possible in ophthalmology. Many of my friends and juniors have done in University of Toronto, and some of them have even settled down there. So that's a very good opportunity. And University of British Columbia also offers similar fellowship programs. If you go through the Canadian Ophthalmological Society website, it lists all the fellowship opportunities in Canada, duration, number of spots, and the name of the preceptor and the email ID of the preceptor to whom you can directly write. You can look at the number of opportunities that are available in Canada. Incredible. So this is something that is not in the knowledge of Indian ophthalmologists. So we should actually explore for Canadian fellowship opportunities. Now, international fellowship in the UK. First, you have to shortlist where exactly you want to. That is the first step. You have to choose between clinical fellowship, clinical and research fellowship, or a research fellowship. So if you go through idocs.co.uk, you get a listing of all the fellowship opportunities that are available in the UK. Again, you can find an Excel sheet there where each area of ophthalmology is listed along with the place that offers the fellowship, the duration of the fellowship, and the contact address and the email ID to which you can directly apply. So once you've shortlisted the course, you apply. Application generally starts, the whole process starts about a year in advance. If you have FRCS, ophthalmology, part 2 or equivalent, or any other FRCS of say Edinburgh or Glasgow that is useful, you also need a GMC license. Now, GMC license can be got by taking PLAB exam or by dual sponsorship or approved postgraduate qualifications if you already have. Now, for GMC license, taking IELTS is mandatory. Minimum score is 7 in each skill: reading, listening, writing, and speaking. So English knowledge skill is very important and you have to prove it, or take PLAB. I wouldn't suggest PLAB, but rather go through the route that is by using the dual sponsorship scheme. Dual sponsorship scheme is unique in the sense that it needs an Indian mentor who is sponsoring you and a UK mentor who is going to take you. So both of them have to sponsor you, an Indian mentor and a UK mentor, and that is fairly easy to get. In fact, you don't even need dual sponsor. You need a single sponsor if you go through some of the fellowship programs, such as Professor Duva's fellowship program, where you need just Professor Duva as your sponsor, and that directly gets you a GMC registration. You don't need PLAB, you don't need anything else except a good IELTS score and a recommendation or sponsorship by Professor Duva. Otherwise, you would need double sponsors or approved postgraduate qualifications, which mean that you have to have an FRCS. So in dual sponsor route A, you need a UK sponsor and an Indian sponsor. In route B, you have a primary UK sponsor and you need a secondary UK sponsor with or without a Indian sponsor. Approved postgraduate qualifications are FRCS Edinburgh, Glasgow, MRCS Glasgow, and MRCS Edinburgh. So if you have any of this, in fact, if you take ICO exam, you get an MRCS anyway. So using that as an approved qualification, you can apply for GMC license, where Royal College sponsors your GMC license. So once you got the GMC license, you go for Tier 5 or Tier 2 visa, and you're in the UK for your fellowship. Now, what about Australia and New Zealand? Australia and New Zealand also offer fellowship programs without having to clear an exam, but FRCS is preferred. So it is coming back repeatedly that FRCS is something that can open a lot of doors for you. So if it is possible, take ICU exam and then get an MRCS and then do FRCS. All this you have to plan during your residency or during your clinical fellowship. You also have to have an IELTS score of more than 7, and application is by direct contact. Australia also has a friendly work culture, not a very high volume. And these are the locations. RANSCO is the Association of Ophthalmologists of Australia and New Zealand, Royal Australian and New Zealand College of Ophthalmology, in the website of which you'll find a listing of fellowships in Australia and New Zealand. Fellowships in New Zealand are also very attractive. In Singapore, you have a hands-on fellowship. Some of these are paid, some of these are unpaid. Again, here FRCS is preferred. Singapore is not a high volume country. You have two main fellowship destinations in Singapore. One is SNEC, Singapore National Eye Center, and National University of Singapore. You can see a listing of overseas fellowship in SNEC website. You have almost everything, and many of my juniors and some of the recent postgraduates have joined the University of Singapore and SNEC fellowship programs. These are extremely attractive because you have a very nice lifestyle in Singapore. Last but not the least, we have ICO fellowship. In ICO fellowship, the requirement is that residency training should have been completed. You should be under 40 years of age and must return to native country after training, resume whatever positions, previous positions or a new position. If you're passed ICO basic science exam or ICO clinical science exam, then you have a better chance or you will receive special considerations. So on the ICO website, you have a listing of 3-month as well as 1-year fellowship. These are relatively easy to get. New entrant is IOFF. IOFF is International Ophthalmological Fellowship Foundation, which is an offshoot of ICO that also offers 3-month and 1-year subspecialty fellowship programs. These are the deadlines for application. There are about 70 institutes that are listed in IOFF website to which you can apply for a fellowship. APAO also has fellowship. APAO also has a special fellowship for women ophthalmologists, and APAO website lists that these are funded fellowships, but funding is not very good. It's about $200 US per month, which is very less for sustenance. If you're someone who is interested in community ophthalmology, then these are the fellowship opportunities. Very big names in ophthalmology, but they offer community ophthalmology fellowship, after which you can do, you can work in India in community ophthalmology. If you want to really travel the world, then Orbis fellowship currently, because of COVID, etc., Orbis fellowship is not being offered, I believe, but it is a wonderful opportunity. That was me 20 years ago doing my fellowship at Wills. So it actually changes your life and opens a lot of opportunities doing a fellowship in India as well as abroad. Thank you so much. So if you have any questions, I'd be happy to take.
Very, very nicely covered. Absolute comprehensive, in-depth knowledge. Even it was so many things were new for me also. So definitely is going to be a big benefit for the new fellows, the postgraduates, and those who are doing residency program. Before we start the panel discussion, I'd just like to introduce the co-moderator also. I just introduced Dr. Pooja Mehta. Let me introduce Dr. Himika Gupta. She is the consultant who is in the, just a minute.
I've lost you.
So sorry. Yeah, Himika Gupta is an ocular oncologist and ophthalmic plastic surgeon with special interest in artificial eyes and the eye care for cancer patients. She is trained from KM Hospital, GMC Nagpur, and at the LV Prasad Eye Institute under Dr. Santosh Honabar. Of course, he is the mentor. Thereafter, she trained and worked in Canada at the University of Toronto. Currently, she runs her clinic in Navi Mumbai and is a visiting oculoplasty surgeon at the Wadia Children's Hospital, Mumbai, and at SRCC Children's Hospital, Mumbai, and the Global Hospital, Mumbai, and so also Apollo Navi Mumbai Hospital. Welcome, Dr. Himika Gupta. Both of them are students of Dr. Santosh Honavar. Over to you for moderation and the panel discussion.
Thank you, sir. Pooja, you want to start?
Thank you for an excellent talk, sir. So there are a couple of questions which we've got from students. How do generally the finances for these international fellowships work? Is there a sort of stipend or scholarships, and what sort of fees involved for the fellowships if we have to do abroad?
Only observerships carry a basic fee, but you don't want to do observership. If you want to do a clinical fellowship, if it is through SF match, it is very well paid. If it is beyond the match, whatever are the vacancies, those are also very well paid. If you go for an international fellowship from, say, UCLA, again, it is a paid fellowship. But if you want to do fellowship as a supernumerary position, international fellowship beyond what are the available vacancies, then these are non-paid fellowships. You are responsible for your own upkeep. And that costs about $2,000 per month, including stay and food, etc. So we don't ask for payment, but some of them pay, some of them don't pay. If you go through ICO for 3 months, you get about $6,000, and you can extend that to further 9 months to complete 1 year. But for the rest of the 9 months, you have to fend for yourself. If you go through, the new organization, IOFF, then they pay about $24,000 per year. That's $2,000 per year. So that's again paid. So some of these are paid, some of these are non-paid. But well, I mean, there are good opportunities. It's not that, if you plan well, you can somehow manage payment.
So according to you, sir, if you're getting an opportunity, then finances should be not of your prime concern, and you should just go for, even if it's a paid fellowship, you should, if you're getting an opportunity, go ahead and take it, because
Absolutely.
It's going to add to your CV and your skills at the end of the day.
You don't have to pay anybody anything. It is just that you have to take care of
Manage
yourself.
your
If you have a
finances.
relative, that's fine. Otherwise, you probably have to find a place to stay and enough money to eat. That's it.
Sir, and what about like big names and big centers, or small names also have good hands-on work? So would you take a smaller ophthalmic center in the US which doesn't have that big a name but is giving you good hands-on work, or should you go after fellowships which just have a big name?
I would suggest that, first you have to rule out the possibilities in standard institutes, the top 5 or top 10 institutes in that area of specialization, and top 10 mentors. You have to apply to all of them, and if you can't get it, then you go for lower place, because some of the lower places in say US are not as good as some of the best places in India. So if you really want to train from the best, then you have to go for top 10.
If I have to interfere, excellent presentation, sir. Really, really impressive. Feels like that I feel like going for a fellowship again.
Again, yes. And so many avenues, didn't you?
Yeah, we have struggled a lot. Our time, there was no internet. We didn't know how many fellowships were available. And as he said, I tell at every undergrad student in second MBBS, I tell them, whoever I meet, first finish your USMLE.
Absolutely.
Whether you ever plan to go to US or not, don't waste your time. Finish your USMLE. Step 2, by internship. Best message I can pass on to any junior.
Absolutely.
Whether you need it or not, because your knowledge is fresh, you don't have time, you not spend time in ophthalmology, and to read 38 molecules of 80 being manufactured in Krebs cycle after your MS degree. Believe me, it is a pain. I've done that. For USMLE microbiology, and doing that is a pain. It will take your time. It will kill you. It will murder you. So you rather have your USMLE cleared very much by the time you finish your internship. That's the first part I would say. Second, of course, all good institutes, as sir said, is a perfect answer. If not, like even you going for undergrad to US, the dream colleges, Harvard, Stanford, MIT, USCLA, Berkeley, these are the standard of dream colleges. If you don't get, then there are many other colleges anyway available. So you don't have to go for the other lesser names. But most important, that I would give you a hint of a lateral way to get into fellowship. I've done it, and the best way to do it is this. You need time and patience in the US. Remember that US is a country of immigrants. So they'll never throw you. And they know, those guys who are there, know that you struggled a lot to cross 7 oceans and come there after your fellowship, after your residency. So they already have some basic respect for you. They'll not look at you. But if you persist and if you are there, start. The best way to get into the US residency program, besides fellow, if you really plan to get into it, is to do a year or two of a research fellowship in any field, pediatric ophthalmology, oculoplasty, glaucoma, whatever. You learn a lot, you will present a lot of papers, you will get close to your bosses there in that department, and you are almost sure that you will get into a residency program within 2 to 3 years after doing your fellowship.
Wow.
This
Very
is
good
the
tip.
best, this is the best hint I can give you that I have learned in my life. To get into US, it is difficult, very difficult, but not impossible. That is the best thing about United States. You have to persevere. You have to prove that if Colin Powell, a black guy, becomes the US Chief of Army Staff, if Obama can become, a black president can become the president of the United States, you have a far better chance than that. Because there are multiple, presidency is only one.
Yeah.
Residency, there are quite a few residencies and fellowships available. So don't lose hope. Time, people will dissuade you. People will tell you it is not possible. It is very difficult. It has got progressively difficult, but still I have enough ophthalmic friends in the US who got into residency and the rest of the program. Persistence and doing a clinical research fellowship or even a pure research fellowship, by the time you are getting acclimatized to the US environment of studying and the way they present their papers. That's the first thing that I would start with. That's it.
Great. Very nice tips, boss. Himanshu boss. Over to you, Pooja. Go ahead.
Himika ma'am, do you have any questions?
Hi. I just have one question, sir. Thank you for the excellent talk. And thank you, Himanshu, sir, for your tips, for your pearls. Thanks. Is it, sir, there's one thing wanted to ask, post-COVID era, is there something special or is there a special message you would like to give to the young ophthalmologist? What to keep in mind? Because most of us, like when we went for fellowships, it was pre-COVID era. So what has changed and how to be prepared for that?
Nothing much has changed. In fact, patient contact has come down slightly, and they're relying more on, some of them are relying more on teleophthalmology for follow-ups, etc. And satellite clinics where only one doctor goes and evaluates the patient, and the consultant actually sits in the base hospital and looks at the pictures of the patient and talks to the patient over a telecall. So that is the only thing that has changed. But US brings back to normal very easily. I think now, since the COVID is tapering off, it's just a matter of time before they all spring back to their normal, work culture. So I don't think there is much change. In fact, it's become slightly easier post-COVID to get into fellowships. This year in SF Match, beyond the match, the number of vacancies that are available are mind-boggling. Anybody can walk into any of these fellowship programs, which are extremely good. That was never there last year.
Yes. Also, one last comment, may I? The Emily point is very valid. In fact, when I went to Canada and I wanted to apply for University of Toronto fellowship, they said that USML, you have to come via the SF match. Your MLE points won't count, but you have to register under the SF match. Now, in order to register under SF match, you need your step 1 score. That's it, not 2 or CK. Thankfully, like Dr. Himanshu Mehta sir said, in my internship, I had done my MLE, and those scores really helped almost 6.5 years after completing. Yeah, so that's important. And I never knew earlier that in Canada also they were useful. So that was interesting.
Santosh boss, more about the SF match, can you explain? Because there are a lot of new postgraduates who have joined. for them exactly? How does it go about it?
It's a fellowship matching, it's a residency and fellowship matching system where if you have USMLE, you can go the right royal way of matching formally. But if you don't have USMLE, there are what are called post-match vacancies. That means those positions are unfilled at the end of the match. So those positions are advertised on the website. If you look at ophthalmology and narrow down your search to say cornea, you will get all the vacant positions in cornea post-match. Post matches can be acquired without even going through SF match. You can directly apply to the organizations or the mentors. So how does it work is in California and Pennsylvania, you don't even need USMLE, they are waived. You can actually get a waiver very easily. But even in other states, you can do a clinical fellowship with USMLE waiver if you are applying for a post-match residual vacancy. That is possible. I mean, it is not promised, but it is definitely possible. Now, there are a couple of examples of Indian ophthalmologists who don't have USMLE who have got a faculty job in the US. You know that, right? Couple of them from Shankanetralaya.
Yes,
right?
yes.
And others as well. So doors are opening up for good people. In fact, University of Pittsburgh has a bunch of ophthalmologists from India, none of whom have USMLE yet.
Oh.
As faculty.
That's great, yeah. Actually, what about the age bar? Maximum is what to apply for the fellowship? 40
there is
plus?
no age bar. Western countries, they don't respect age. In fact, many
Jignesh
of
Bhai,
them...
I've given USMLE with a 55, 60-year-old Russian people.
Oh.
There is no age bar. You have to understand when you are in a desperate country like with Hamas and Syria and Russia, you have no idea how lucky you are in this country. So age is 0 bar for appearing for your exam. But the space between USMLE step 1 and step 2 is not more than 5 years.
Okay. Oh, that's good. Yeah.
Age is normal, but ideally 40,
one more.
Just after residency, if you do it just after fellowship, you do it in a flow. Otherwise, you waste a lot of time. You take time to settle down as well. So I would say, as Himanshu said, during MBBS, do USMLE seriously, irrespective of what is your residency going to be in. Even if it is residency in pathology, clinical pathology needs USMLE, clinical radiology needs USMLE. Just do it off. And then following residency in India, following a clinical fellowship in India, then you can really get one of the best spots if you already have USMLE.
One more thing which Santosh said, he was correct that he got a faculty position in an institute, but it is only institutional license.
Yeah,
because you will not be able to practice anywhere else. You cannot. Now you are married to that institution.
Yes.
That is the beauty of United States. Now they have kept you as a white collar slave. Remember, they love this. All PhD students in the United States and all that are the exploited, unfortunate people from the rest of the world, the smartest of the brains, where they have to pay $500,000. They'll pay you $30,000 to $40,000 and get away with it. So institutional license will be again difficult for you to break out of that practice. Otherwise, you have to back to square one.
My goodness.
But you become board eligible as well during that period.
So board eligible is only if you have USMLE. And you have to do, if you do residency in US, you need 1 year of internship, by the way. Okay. You cannot start your residency program without that.
Oh, so where do you do that then?
They will post you everything. So buy time, have patience. 10 years gone for your visas, for your H1 visa to convert to green card, to get into Kentucky, get into whichever, Ohio, upstate New York. Any places where a white American doesn't want to go is where you will get it.
I see. Any more inputs, Himanshu Bhai and Santosh boss?
I think we have covered most of it.
Dr. Santosh, I just want to ask you one thing. For fellowship, what you should think of? Research work, surgical work, or clinical work?
I think it should be a good combination of all three. Clinical work is the basis for everything. If you know how to diagnose a patient, how to decide on what is the treatment protocol, then half the work is done. Surgery has to be part of the fellowship. And if there is a research component as well, while you do your clinical and surgical work, if you can do some research, good research, and present and publish, that will pave the way for your academic career. So a good fellowship program should have all the three components, and all the institutions currently offer all the three components.
Achha, between US and UK, what do you prefer to
Between
send? Suppose between USA and UK or Australia, New Zealand, which is the best? You say US is the best, or
I
UK
have
is
a
good in
bias
certain?
towards American fellowships because they offer a lot and the mentors are extremely good. But UK, selected mentors. Suppose somebody wants to train in a particular aspect, say do orbital surgery in Moorfields with Jeff Rose. Well, that is the best, unquestionably. You have
Absolutely.
icons in UK who you can train with. You have similar icons in, say, Canada, who you can train with. For example, retinoblastoma fellowship with Brenda Galley is considered one of the best. So things like that. So
It's
I
selective.
would be positively biased for the US.
Yeah.
Because for New Zealand, Australia, UK, they all still come and apply for USMLE, and they try and settle down in the United States. So that
USA is the favorite destination for majority
so
all over
why
the
we
world.
find
Leave
why
India.
we start going elsewhere?
Absolutely. So nice. So, any expert comments by Himanshu bhai before we sign off?
No, brilliant presentation by, as usual, our boss. He is the ultimate in teaching faculty. It was
Yeah,
fun.
that's what I think.
I'm reliving my experience of the fellowship, and it's a great feeling. Don't give up hopes, friends. That's all I can tell you. I've struggled for a year plus to get letters of recommendation from anyone. This is way back. Nobody wants to do that very easily. FRCS and England and all that, difficult to get. You need your PLAB and you need to get there. You will get it elsewhere. All these places you need patience. Now, what is happening is you already spent 32 years of your life here, not earning. And then again to stay there not earning without a house. When my daughter Pooja was born, 6 months, she was after that I took a fellowship in the US. So imagine how difficult it is when you're not making money and then you're trying to stay afloat over there.
My goodness.
But that is not making money. So you have to have that
Oh.
guts to say that you will not make money for a year plus for the
Correct.
future to be there. That's it. So don't lose hopes. There is some hope at the end, and you have some fantastic training. You have the boss right here, Dr. Honavar, who is there in front of you, people like them. A lot of excellent fellowship being offered in this country. We are no longer second best anywhere in the world. Only and only if you are wanting to migrate or you want to do something else because you want to have what's going on in the rest of the world to change your dimensions and perception, you should go and spend some time abroad. No question about it.
What about Santosh bhai? What about research? How good are we now? Are we at par with the US, or we are still a step?
we are not in par with US. That will take a long time, but we are picking up. In fact, last year's data shows that we are number 2 in terms of ophthalmology research output. We have overtaken UK, France, Germany, China, and we are number 2 now. So
Wow.
we hover
That's
between
good
number
to
2
hear.
and number 3. Sometimes we are ahead of China, sometimes we are behind China, but US is the top. So
Jignesh,
yeah, we are picking up.
Jignesh, you know how much money they get for funding for research? Do you have any idea?
No idea.
All the bosses all the fellows and all the bosses are not paying from their pocket. All these are research fellowship being funded by the National Institute, NIH or whatever. And there is a huge money which is made by everybody. You are a peanut hardworking fraction like an ant worker to get into that. So that kind of money in India is difficult, but despite that, our institutions are producing so much good work.
So that's nice. So big thank you, Dr. Santosh Honavar sir, for being with us, guiding all this. Our times, as me and Himanshu just said, there was nothing, nobody to guide. And here we have got a huge platform. The MOS is one of the platforms which has got the Young Ophthalmologist Forum, and we have the moderators also who are quite dynamic, Dr. Pooja and Dr. Himika, who questioned, they did a very nice panel discussion. And of course, your talk was very comprehensive and very in-depth to give an idea to the fellows who have just joined or who have just finished the fellowship or they were still the postgraduates. Fantastic tips from our host faculty, Dr. Himanshu Mehta also. And especially called him, it was a pleasant surprise for you people. I had not printed had actually invited him in last moment, but fantastic tips from you, Himanshu bhai, as usual. And of course, our joint secretary, our honorary secretary, Dr. Ajay Joshi, always there to back up. The enrolled people, they giving a fantastic technical support. We are a big thank you to them too. So now I hand over this thing to the honorary secretary, Dr. Rajesh Joshi, for the vote of thanks.
Yeah, thank you, sir. In fact, I feel Dr. Santosh has become a family member of MOS.
And he's an icon for us.
Yeah,
Everybody
icon,
follows him.
yeah.
I'm a member of MOS actually.
Yeah. That is a pleasant surprise for me
Yeah,
also.
it's
Very good.
really a pleasure having you here. You have in fact told us so many opportunities which are available nationally as well as internationally for fellowship. And Dr. Himanshu, as usual, gives surprises. But nowadays I am missing his webinars.
There
No,
is a
sir?
nice one on crypto next week. So
Next week.
Crypto pe
Okay.
hai kya? Good, good, good.
Great,
next, it's a very nice talk on crypto. Join it. I'll send you the link. It's on the crypto.
He is also going to give us a very, very big, pleasant surprise. One of the Brahma Kumaris, who is very well known. We are going to get it on the MOS platform very soon, courtesy Dr. Himanshu bhai.
Thanks to Dr. Pooja and Himika for conducting so well. And of course, Entor for providing technical support.
Thank you, sir.
Thank you so much.
Himika and Pooja did a fantastic job.
Thank
Santosh
you.
bhai, we can stop the recording so I can just have a little chit chat with our bosses. Sayyed?
Just a moment.